The number of people killing themselves in prison has been rising for more than 40 years. The death rate from suicide is now 10 times higher than in the outside population.
If somebody had listened to him, Danny would still be here now. He didn't just go to him once or twice, it was so many times he asked for help and they just ignored him.
I did expect him to be safe in prison, but obviously he wasn't. They should have took better care of him.
Because he was vulnerable?
Yeah, because of his schizophrenia.
In the early 1980s, around 25 people killed themselves each year in English and Welsh prisons. The prison population has grown by 90% since then. But the rise in suicides far outstrips that. In the last decade, on average, 80 people a year killed themselves in jail, a 220% rise. Newsnight has analysed coroner's reports for every prison suicide since 2016. In 7 out of 10 cases, staff training is mentioned as an issue. Prison officers receive special training to help them protect vulnerable prisoners. A key part of this is known as SASH training, suicide and self-harm prevention. All operational prison staff are meant to have refresher courses, but COVID lockdown has stopped training. But our data obtained under the Freedom of Information Act reveals that some prisons, even before this, weren't doing enough SASH training. SASH training was introduced in 2017 after a spike in suicides. 124 died the previous year. The Ministry of Justice told us that SASH courses have reached 25,000 staff. The MOJ says all frontline staff are meant to do refresher courses roughly once every 3 years. But the FOI data suggests around 20% of refreshers across the prison estate were not done in the 3.5 years to December 2020. But there's a huge variation, with some prisons doing well, while others do very little at all.
SASH training, suicide and self-harm training is obviously critically important. We have so many vulnerable people in prison that we need our staff to be adequately trained to deal with them.
In 2019, 20 prisons did no SASH refresher courses at all, and more than half of those had at least one suicide. Mark Fagnoni killed himself at HMP Bedford in 2016 while awaiting trial for alleged robbery.
Mark was quite a bubbly, outgoing child. As he got to teenage years, then I noticed a bit of a difference.
What was that difference?
Where he would talk to people that weren't there, swipe the air like that.
A third of prisoners who killed themselves, like Mark, were on remand.
He didn't know when he was getting the next court case to find out what was going to be happening. He felt as if he was in limbo.
Mark had a long history of mental illness. He'd been diagnosed with paranoid schizophrenia in 2007 and was extremely vulnerable.
I would really question why somebody who clearly has a diagnosed mental illness is in prison, because prison is not a safe, decent, therapeutic environment for somebody who's mentally ill.
Soon after he entered the prison system, he told mental health staff that he was hearing voices urging him to self-harm and to harm others. His antipsychotic medication was increased. On the 18th of May, Mark told a nurse he'd had thoughts about hanging himself. Prison officers say this crucial information was not passed to them and it wasn't recorded in official records.
If the individual was talking about suicidal thoughts, that absolutely should have been shared with the prison officers.
By now, Mark had been on remand here at Bedford Prison for nearly 5 months. His mental health was deteriorating fast. A prison officer said he was buying the drug Spice and he was getting into debt. Nothing was done. On the 7th of July, he was moved to the main prison wing. 4 days later, an officer saw he'd cut himself in his cell. Only at that point was he put on the prison's suicide prevention programme known as ACCT, Assessment, Care in Custody Teamwork. He was now on suicide watch. The same officer saw him handling a sheet, but accepted his explanation that he was making a curtain and left him alone. 13 minutes later, he was found hanging in his cell. Still alive, he was transferred to hospital.
It got to about 3 o'clock in the morning when his bed just started shaking and his body was shaking and his bed went so bad I had to say to the nurse that, sorry, I can't stand this, it's too bad. And the nurse said he's just having like a seizure.
Mark was brain dead and life support was turned off. His mum, who carries his fingerprint on a charm, donated his organs.
I did expect him to be safe in prison, but obviously he wasn't, because if they'd looked after him properly, he probably would have been here now.
So why didn't prison officers at Bedford intervene earlier? The Prisons and Probation Ombudsman has serious concerns.
Mr. Fagnoni's risk of suicide and self-harm was not identified and managed adequately in Bedford. In particular, the mental health team did not share key information, which meant that staff missed opportunities to manage his mental health and risk of suicide or self-harm.
This is the action plan that Bedford Prison agreed after Mark's death. It talks of more information sharing between medical and prison staff, and crucially, there's this paragraph. Annual refresher training will be provided to staff to ensure they have a full understanding of the triggers and risks for prisoners who are at risk of suicide or self-harm. But RFOI data shows that annual refresher training hasn't always been done. At the end of 2019, Bedford had 209 operational staff. A full SASH course is 6 modules. The UFOI data shows that in 2017, 169 modules were done, the equivalent of 28 operational staff completing the course. In 2018, it was 195 modules. That would be 32 operational staff completing the course. And in 2019, just 6 modules were done. That would be just 1 member of staff completing the course. That's a terrible record, isn't it?
Yes, obviously. It will never equip people with the skills to care for people who are at risk. We know what makes people sick, staff-prisoner relationships. Because of the staffing shortages through austerity, that relationship between prisoners and staff was very clearly compromised.
That is absolutely terrible, because you hear that they're going to do it and then they just go backwards instead of forwards.
But is it about resources or culture? The suicide in 2018 of Danny Akam at HMP Lindholm in South Yorkshire is a truly shocking case that reveals attitudes of some prison staff towards vulnerable prisoners. Danny Akam was 43 when he took his own life. We spoke to his former partner and mother of his son.
He was wonderful, he was funny, he was caring, he was kind, and he was my only friend. If he was everything that the papers made out, I definitely wouldn't be sat here now.
According to the coroner's report into his death, Danny had a history of anxiety, depression and self-harm. In 2018, he told prison staff he was receiving threats from other prisoners.
He was scared for his life because somebody was out hurting him, and he was trying to get removed from the wing he was on, and no one was listening to him.
When he disclosed he'd had suicidal thoughts, prison staff put him on suicide watch. Prison records showed he had regular safety checks. In fact, the visits to his cell were never made. 5 officers on 18 occasions fabricated prison records to make it look as though the requisite checks had been done.
I got told in court, when we went to court, it came to light of all the failings, and I absolutely just cried my eyes out. I actually had to leave the room, because it's okay to fail on several times, like your human error, that you can forgive that, but not on 18 times that we know of. They didn't just go to the record and say, a ticket, we've checked Danny. They actually said, oh, Danny put his thumbs up, he's watching TV, he was relaxed on his bed. They didn't even, so that's deviancy, that's lying.
An inquest jury concluded the fabricated checks did not lead to his death, but faking records was highlighted by the coroner. It was not referred to the police, but the dishonesty raises huge questions about the attitude to vulnerable inmates amongst some staff. The 5 officers who faked the records received a written warning.
Oh, that's not punishment, is it? They're still working as far as I'm aware.
You must think that if the prison officers had taken better care of him, he might be alive today.
I know, and it's infuriating. I get angry, I get upset, because that's what they're paid to do, look after people in need. But I feel as if prisoners are deemed to be treated differently to other people. It's somebody's life that could have been saved, but it wasn't because of their failures, neglect.
The Ministry of Justice told us that HMP Lindholm has strengthened its processes following Danny Akam's death. It declined to be interviewed, but a spokesman said,
"Our thoughts remain with the families of Mr. Fagnoni and Mr. Akam. Self-inflicted deaths in prisons are at their lowest since 2012, and we work closely with health providers to reduce them further by improving support for those at risk."
The Prison Governors Association believes the current relatively low suicide rate is probably a consequence of COVID lockdowns, and the numbers will rise again.
This was the last letter that I ever got from Mark.
Christine, whose son Mark killed himself at Bedford Prison, wanted us to see the suicide note found in his cell. Yeah, it's pretty stark, isn't it? It says, "To who may find me lying here dead, sorry to tell my family." The MOJ is reviewing its suicide and self-harm prevention programme with the aim of cutting injuries and deaths. There's no doubt about the human cost of getting this wrong.